Good day, my dear postgraduate students. It has been my observation that the students of the first, second, and third year alike are finding it difficult to approach and retain pathology. So I thought that I would suggest some kind of an approach to pathology, a step ladder pattern. Let us see if it works out. Step ladder obviously means step by step. What I had done here was I have divided your days into 7. Day 1, day 2, day 3, day 4, day 5, day 6, and day 7. And I have started a program from the rock bottom of day 1. For example, on day 1, I am going to read only one undergraduate portion, namely necrosis. Only necrosis, only undergraduate portions from Robbins or anything. On day 2, I am slightly uploading it. So I have got apoptosis along with necrosis. That is there. At the same time, I am introducing a totally unrelated topic, prothrombin time and APTT. So this is day 2. Day 3. So I have read necrosis, apoptosis. It is again, I am repeating the same thing along with gangrene. So this is too simplistic. For the third day, I am doing it. So I thought I will introduce a postgraduate topic, namely approach to bleeding disorders. So this is a vivid topic, extensive topic. And another thing we would have read during our undergraduate days itself will be von Willebrand's disease. Look at the total lack of relationship between these. Necrosis, bleeding disorders, von Willebrand's. So this is a 3-day program that I've shown. I have blocked the rest purposely so that you people can concentrate on it. So look at the stepwise approach that I have planned. Now I'm going to day 4. So undergraduate 4. What I do is the entire irreversible injury along with the flow diagram. I do it. Also, there is a repetition of the approach to bleeding disorders. This has been done earlier. I am again repeating it because it is a vast and a difficult topic. I have already read von Willebrand's disease, so I add one more small topic, namely hemophilia. See how gradually I am increasing the volume and the tempo. And it is always nice that we by heart some classification some week. So it can be whatsoever you want. Classification of leukemia or a lymphoma or bone tumors, whatever it is. Let us by heart one. Day 5, I am going to calcification. I am again continuing with the chapter 1. And please see this, I am again repeating approach to bleeding disorders. So for 3 days consecutively. Now you find this will be occupying very little time. And of course, this also is a revision for me. And so I am adding one more undergraduate topic, namely IT. So this is day 5. On day 6, at one stroke, I want to revise the entire chapter 1. So it will be easier because 75% of it I have covered. So I do that. And having touched the bleeding disorders, I read disseminated intravascular coagulation. It is a little weird topic, I am doing it. And also specific investigations for platelet disorders. So this is day 6. I am having some kind of a pattern of reading. Now, what else is there? Day 7. All these having been completed, day 7. I choose any topic which I feel is difficult for me. Obviously, all topics will not be easy. So I choose any one difficult topic. Also choose any easy topic. It is always a dictum that you study a difficult and an easy topic simultaneously. And also a PG small technical topic that is needed. Small technical topic, anything that we can think of. I shall be showing you that in the next slide. So this is a step ladder pattern of approach. You people can design your own, but spend a little time. So it is a program for 1 week. The basic concept is I'm reading a UG question, a UG plus PG question, an easy and a difficult question. I'm repeating any if required, adding on to it, and any practical note, any practice of it, which I should actually be doing. So this is one way of approach, a concept for the step ladder. Now, what do I mean by it? Look at this plethora on the screen staring at us. I would very much want you people to have these with you. Obviously, Robbins. I'm just putting a book. It does not mean it is this edition and this book that should be there, your own. It is a standard for the chapter 1. And for hematology, it is better that we have a half brand or some other recommended text from which I will be reading a hemophilia or a platelet disorder or whatsoever. And my R.A.T.S is just a thematic one. You find that many of the topics in chapter 1 as well as the bleeding disorders will be there. Again, read R.A.T.S, go back to Roberts. That is one. And as I do read, I am supposed to compile my own notes. Have a separate set of notes for each of the subject so that eventually you will be having a golden treasure with this is. As I had been mentioning earlier, one technical topic, for example, electrophoresis, which I had taken, or you can take any topic that you need because this will be totally dry, we will be omitting it. So one technical topic. I have covered these, this and this. And of course, day to day there will be, this is a theme again from my channel called the game. But microscopy or gross, you would have been seeing any specimen or slide that is interesting. My professor used to say, look at the slide. The slide should take you to the. So this much is so good. Obviously, you should not be tied down to this. Go attend the other conferences. It can be an academic society meet or something. There are many other things that we can learn. One is away from the maddening crowd of the department. Two, you find how the others present. The ambience is different. They may be giving you some snacks. So try to incorporate that. So this is the way you people can plan 1 week. Having said that, how do I improve upon it? So look at my next slide. All these we are supposed to read, listen, observe, and then forget. I'm using the word forget. This is yet another slide. Can you people tell me the difference in this slide? So there is again the basic pathology, the hematology, almost all are same. But I have made one small difference. The technical theme is different. So there for the second week, there will again be a different set. And I have got a different technical topic, namely bone marrow aspiration. And similarly, you people in the meantime will be seeing slides and specimens. So that will take you to the. And look at this very carefully. I am taking you to the next step, introducing to you to a reference book such as Ackerman, which ideally you people should possess. So from that, I'll be reading something which is not found adequately in Robbins. So there will be some other thing, maybe a diarrheous disease or the variant of an osteogenic sarcoma, whatsoever. So this is one way. And after having followed this theme for a period of about 1 week, it is time for you to relax. We shall again see you with the next set. I would solicit your feedback to this channel. Thank you.